Good morning, everybody. It's now 10 o'clock, and so we will get started. My name is Gary Swansky. I'm the Chief Operating Officer for the Alberta Retired Teachers Association. Joining me today is Darren Tardif, the Manager of Pharmacy Operations for ARTARx Pharmacy. Also joining us today are Amanda Shaw, ARTA's Chief Marketing Officer, and Jennifer Hope, ARTA's Manager of Marketing and Promotions. Please note that your cameras have been turned off. That is so that we can record this for showing on YouTube after the fact, so you can come back and rewatch this presentation if you want to do so. And therefore, we don't need to go to you to sign privacy agreements because we've left all of your cameras off. If you do have any questions for us, please type them in Zoom's Q&A box. If you see there's a button that says Q&A, if you send your questions into us using Q&A, we will respond to them directly to you via typing them. We'll also spend some time at the end of the presentation in order to speak to some of your questions. So enjoy today's presentation. With that, Darren, I'll turn it over to you.
Thank you so much, Gary. All right. So thanks everyone for coming out today. I'm very excited to speak to everyone about what ARTARx is. And so at its simplest, ARTARx is a plan-owned pharmacy. It's also a community pharmacy, and it was built specifically to serve ARTA members and the general public, and it also works in tandem with the ARTARx Health Benefits Plans. And so as a nonprofit organization, for ARTA, priority is the well-being of its members. And ARTARx serves as an extension of that business model. It's a very unique approach, and what it was designed to do was to support the members' requests for affordable and impactful pharmacy services to better their health and their health outcomes. ARTA leadership and members both recognize and value the positive impact that pharmacists do have on health. And so this is kind of an extension of ARTA's willingness to invest in professional practice and pharmacy itself to improve member care and offer an alternative. Next slide, please. So why did ARTA open a pharmacy? And so ARTA leadership identified that a plan-sponsored pharmacy, ARTARx, would support key strategic priorities as identified in ARTA membership surveys. And so those were some of the things that I had spoke about before, where we're looking for better, more affordable healthcare, easier access to care, those types of things. Now, revenue from the pharmacy itself, from ARTARx, goes to improve the overall value of ARTA Benefits Plans. Being a nonprofit, all the profits that generated from the pharmacy, they all get put back into ARTA. And so this allows us to do a little bit more with those plans. ARTA also can now offer competitive pricing on over-the-counter medications, vitamins, supplements, and even home healthcare products through this venture. The other really neat thing is Alberta pharmacists currently have the broadest scope of practice in Canada. And as key healthcare professionals, we can now support members' management of chronic health conditions through different ways. So we start to see in these surveys that we had sent out, different statistics coming out. Things like only 12 to 15% of respondents had indicated that they had a care plan completed in the last 12 months, where a pharmacist sat down with them and really in-depth discussed their prescriptions, their medications, and their challenges. And this is something that we're looking to build upon. There's a lot of opportunity for ARTARx to be able to support clinical work in terms of driving health outcomes for our members and our patients. In addition, we can also do things that you might have heard of, like deprescribing, prescription adaptations, extensions, vaccination services, tons of different benefits that we can offer members and patients when they come into the pharmacy, just to be able to give that added value and really bring a lot of extra to ARTA and to the benefits plans that it offers. The other thing that the pharmacy is really keen on is navigation of the healthcare system. And for anyone who's ever had to navigate through a referral or potentially a special authorization, there was a lot of feedback on the difficulty of doing those things. And that's something that our pharmacy professionals are very proficient at and can really offer to those members in terms of a service and a support that you may not see at a traditional pharmacy. Now, the other thing that ARTA had noted is access to affordable care. Well, a lot of survey respondents, I think it was 68%, mentioned they would be interested in transferring over prescriptions to a model like this if it would provide increased coverage or reduced premiums, which is something we'll get into later. So next slide, please. So who can sign up for ARTARx? Who are our members and our patients? Well, as per our legislation, to be able to operate as a pharmacy in Alberta, anyone in the ARTARx pharmacy service zone can sign up for these benefit plans, and we can make use of the services the pharmacy offers. Now, these service zones are intended to have a little bit of a restriction by the legislation where we need to have some portion of in-person care applied at the pharmacy there. And so that's why we can't service places like Calgary and places really far north like Grand Prairie at this time. And that's why you'll see these postal codes listed, is because these are the places where our legislative body has indicated that we can reliably and reasonably provide that in-care service. These are all the locations as well that the pharmacy is able to deliver prescriptions to. And so keep that in mind when we're looking at the next slides here and we're talking about delivery from the pharmacy. So next slide, please. Now, location and hours. We are located conveniently in the same building as the ARTA offices, just on the south side of the building. So we're quite easy to get to if you're already in the area for the benefits plan administration side of things. We, as I indicated before, offer delivery within that pharmacy service area, and deliveries for medications and prescriptions are free of charge. We don't charge you additional for that. The contact information is listed here, so if you ever need to contact us for questions or concerns, this number would work, as well as the email here, contact@artarx.net. And our hours of operation are 9 to 5. We're closed on weekends and statutory holidays. And so I know that sometimes this is a question that gets asked where, what happens if I need something and you're closed? You're not open, 7 to 10, you're closed on weekends. And that is something that we recognized early on and wanted to provide provisions for that. We understand that people will need timely access to their medications, especially if it's something acute like an antibiotic or a pain medication. And so there are provisions built into the ARTARx Benefits Plan that Gary will talk about a little bit later and go into more detail on, where you're able to access those acute need prescriptions without having any concerns. And then you can continue to get your non-time sensitive medications and chronic medications from the ARTARx pharmacy. So next slide, please. All right, so I just want everyone to meet our team. You may have, if you've been to the pharmacy or called us, you may have seen us or spoken with us already, but we've got Yatin Patel, who's the Director of Pharmacy Services, and myself, the Manager of Pharmacy Operations, and we lead the team. We've got a fantastic support team. We've got two very, very gifted clinical pharmacists, Carrie and Kavita, and they are very, very excited, eager, and keen to do a lot of care services. So immunizations, care plans, help people navigate their difficulties and obstacles when it comes to meeting their health goals, kind of the things I spoke about before. So if you're looking for any sort of pharmacy advice or service, they're definitely your go-to. We're supported by a fantastic team of 2 pharmacy technicians and 1 assistant currently. So we have Abby and Morgan, who are pharmacy technicians. And in terms of their scope of practice, Alberta also has a very wide scope of practice for technicians. So if you come to visit us, they may be the ones who are doing a best possible medication history for you or teaching you how to use your new injectable device. We also have Craig, who is our pharmacy assistant and our technology extraordinaire. So he helps us run and keep everything smooth with the PacMed pouching machine, which we'll have a little video on in a little bit here. Very excited about that technology, as well as our automated vial counting technology, so our Script Pro 200 machine. We've got a very diligent and hardworking team of drivers who support the delivery and distribution aspect. We have Roger and Abello, as well as Craig, driver Craig, who supports us too. So if you are receiving deliveries from us, you would see one of their smiling faces bringing you your delivery right to your door. All right, next slide. So a couple of the specialized services I wanted to go into a little bit more detail about are our prescribing pharmacists. So ARTARx does have a couple of prescribing pharmacists, and really our goal for that is twofold. We want to work in collaboration with your physician and established healthcare team to be able to ensure that you have the appropriate care you need. But if there's unexpected situations or times where you maybe can't get in to see the physician or it's just not feasible, then at that point we're here to help in terms of prescribing those things that you may need for either ongoing care or something completely new. A really good example of that is if you have a medication that you need for a bout of cold sores or a urinary tract infection. Those are two acute need prescribing events that we see happen all the time, and it's a really good value to any of our pharmacy patients and members when they need that right away. They don't want to wait 8 hours in an emergency room or till next week or the week after to be able to see their physicians who are already incredibly, incredibly busy. So that's a service I really wanted to highlight because we do get asked about it a lot. Now, we also offer free home delivery. So where appropriate, we can arrange to deliver your recurring medications directly to you. And this frees up time for you to spend on things that you want to do that aren't, either coming out to the pharmacy, driving, braving the winter roads and taking an hour and a half to cross the city. All right, next slide, please. We also offer medication pouching through our PackMed machine. I'll briefly intro it because I know we have a video on it, but it's a technology that I'm very passionate and excited about. What we do is we review your medications, make sure we know exactly when and what you're taking, and then we pop it all into convenient tear packaging strips that we put into a little box. It rolls out and you can tear those with you, take them with you, keeps track of your dosing, and it's a really good alternative to blister packaging technology. We're definitely trying to get people moved over to this, and we've got a lot of positive feedback on it so far. It's very easy to use and really a great service that we're really happy to be able to offer our members. The other thing that we have a lot of great feedback on and patients just love is the medication synchronization. So when patients transfer over to our pharmacy, we try to make it so that on a subsequent refill of your medications, all of your prescriptions come out at the same day, or all your chronic ongoing medications line up. That way, instead of getting one medication this week and a couple next week and a few the week after, and having to make 3 or 4 phone calls, it's all at the same time. It shows up in one convenient package, and it just makes things a lot easier for you in terms of keeping track and administering medications. Next slide. So this is the medication pouching video that we're excited to show you. Medication pouching is a system where we take state-of-the-art technology. We have a massive packing machine, and we can take a patient's order or all their medication regimen and put it all together in these unit dose pouches. What that is it's a plastic pouch that contains all of your medications for a specific time slot or dose. What we do is we work with each patient to individualize their therapy regimen. So if you're taking something at breakfast or lunch or dinner, or maybe even at a time that is a little bit unique to your schedule, we can accommodate that. We program it into our system, and then we take all your medications and we put it into a roll that goes in a handy little pouch here. What you'll see is we've got a reusable cardboard case for it, and when you want to take your dose, you'll pull the dose out of here as such, and all you need to do is just rip off your current time slot. What this pouch is going to have is it's going to have your information, or the patient's information if you are a caretaker and giving medications for someone else. It'll have the medication information as well as the time slot information. And so when you need to take your dose, you'll just rip open the little bag and you have access to your medications. So it's a very easy, simple way of keeping all of your medications organized and being able to take your medications a little bit more consistently. Medication pouching uses state-of-the-art technology to both fill and check your medications, increasing patient safety and resulting in a better experience overall for patients. In terms of putting medications into the pouching, we can do your regular medications, as well as any sorts of vitamins, herbals, supplements, anything you're currently taking as part of your daily routine can fit inside of these little bags here. That way you've got all your medications all together in one spot to make it easier to administer. and easier to remember. If you or someone that you love is taking a lot of different medications, having trouble remembering when to take them, how to take them, missing doses, or really just having a hard time keeping track of all the different vials, all the different time slots, medication pouching is a perfect solution to that issue because it consolidates all of your doses into small, easy to tear pouches, allowing you to take that a lot more easily. Anyone who currently has trouble opening or managing their current medication packaging would benefit from pouch packaging, whether it's blister packs, vials, or anything else that your medication currently comes in. So long as we can put it inside the pouches, it's just a much easier option in terms of not having to turn and press a vial or pop open a blister pack. So it does just increase the ease of administration over the course of the day. If you feel like medication pouching would benefit you or a loved one that you currently care for, please feel free to reach out to the ARTARx Pharmacy team in terms of how to sign up for this service, or if you need more information about making a decision. ARTARx, your health, our priority. Thank you. And then just before you jump in, sorry, I had a couple of really good specific questions about medication pouching that we had over the last couple of webinars. So I wanted to address those now, just in case anyone's wondering. So when you're getting your medications pouch, there is a limit to the amount of different types of medications you can have in each pouch, and it ends up being 5 medications per slot. And that's just for legislative purposes. We need ample space to be able to put the required information on the bag. But if you have 7, 10, 12 medications, then it just means you have multiple dosing pouches at that time. So you could have 2 breakfast pouches, 2 supper pouches, and they would just come back to back and you would open the contents of both and take both at the same time. So that would be kind of how your administration would look in the case that you do have quite a number of medications being taken at the same time. Thanks so much. And with that, I'll pass it over to Gary to talk about the ARTARx travel and benefits plans.
Thank you so much, Darren. As you can see, ARTARx, the pharmacy, is very robust. We are a brick and mortar pharmacy. We're a great community pharmacy, but ARTARx's greatest value proposition is really that investment in technology, which allows our pharmacists to spend time with our members as their patients. They can go over those prescription drugs that a person is taking. As Darren mentioned, in some cases, we've had opportunities to actually de-prescribe medications, because sometimes a person is taking a medication which is going to offset the side effects for one medication, which in turn was offsetting the side effects for another medication. And so sitting down with your pharmacist is really valuable in reviewing those drugs that you are taking in order to make sure that you actually should be taking those drugs. ARTARx, the pharmacy, also operates on a quasi not-for-profit basis. All of the profits are returned to ARTA's members. And the way that we do that is by providing greater benefits and lower premiums for those participants who have elected to participate in the ARTARx Benefit Plan. So ARTARx is 2 things. Number 1, it's a pharmacy. Number 2, it's also a benefits plan that you can participate in if you are within the service region for ARTARx Pharmacy. And that benefit plan offers considerable advantages over some of the other plans which ARTA offers. And one of the biggest differences is the prescription drug maximum. With ARTA's Build Your Own plans, the annual maximum for prescription drugs is either $1,200 per year or $2,000 per year. And those drugs are covered at 80%. If you participate in the ARTARx plan, your annual maximum automatically goes up to $2,500. And we provide 100% coverage for any medications that you get through ARTARx Pharmacy. As Darren mentioned, sometimes it's not possible to make it to the pharmacy. It is closed on weekends as well as any statutory holidays. And if you have an acute care medication that you want to get right away, and it's Saturday morning, for example, you can still go to your corner pharmacy and we'll still cover that medication at 80%. So you don't need to get your drugs through ARTARx, but if you do, we'll cover them at 100%. So any acute care medications we'll cover at 100% through ARTARx or 80% through your corner pharmacy. One thing that we do require, however, is if you are participating in the ARTARx Benefit Plan, you agree to transfer over your maintenance medications to ARTARx Pharmacy for dispensing. As I mentioned, we'll cover those at 100%, but if you decide that you're going to take one of your chronic medication scripts over to your corner pharmacy, we're only going to cover it at 50%. So that is one of the stipulations, is any of those chronic medications, and we'll provide a list in a moment. If you have a chronic medication, one that you take continuously, you have to move that script over to ARTARx Pharmacy for dispensing in order to have it continued to be covered at 100%. Another great thing about the ARTARx Benefit Plans is we have 80% coverage for defined lifestyle medications, including weight management, erectile dysfunction, and prescription hair growth treatments. Currently, those are only available through very specific benefit plans that ARTA offers, called Ultimate Health and HealthWise Plus. But those are automatically covered under the ARTARx plan, and they're covered under the $2,500 annual maximum instead of the limited maximum under those other plans. We do have some other rules that continue to apply with the ARTARx drug coverage. Least cost alternative and enhanced generic substitution certainly apply. If you're not familiar with those, that means that if a brand name medication has a bioequivalent generic drug, that is a generic drug which has the exact same medicinal molecule contained in it, we only pay up to the cost of the least cost alternative, because they're essentially the same drug. There are only minor differences between the generic drug and the brand name drug. So those rules continue to apply if you're covered under the ARTARx plan. The maximum acquisition cost, however, does not apply. The maximum acquisition cost policy only covers up to the second or third least expensive medication within a drug category. And those do not apply to the ARTARx plans, but they do apply to the other plans which ARTA offers. And this is the list of chronic medication categories. So if you are taking drugs continuously for a drug included under one of these categories, for example, high or low blood pressure, and you take those drugs typically every day and you get 90 or 100-day supplies at a time, this is what we consider a chronic medication. And if you are taking a drug which is falling under one of these categories, you essentially agree to move those scripts over to ARTARx for coverage. And the ARTARx plans offer more than just higher prescription drug coverage. We've provided a comparison to the other build your own plans, which ARTA currently offers. You can see that the prescription drug coverage is higher. It's 100% coverage for any drugs dispensed through the ARTARx pharmacy. The base coverage level is 80% under all of the other plans. The maximum acquisition cost does not apply with the ARTARx plan. The annual drug maximums are higher, and we cover those defined lifestyle prescription drugs at 80%, whereas if you have HealthWise Plus or Ultimate Health, they're only covered under 50%, up to $150 per year, whereas they're included under the $2,500 annual maximum under the ARTARx plan. And in addition, your extended healthcare coverage increases as well. Instead of 80% coverage for EHC goods and services, we'll cover you at 90%. The paramedical practitioners, things like massage therapy and chiropractor, are covered at 90%, up to $1,400 per year combined for all paramedical practitioners. Hearing aids is $1,500 every 36 months. Accidental dental is $5,000 per year. Orthopedic shoes increases from the base plans up to $750 every 3 years. Diabetic supplies increases to $2,000 per year. And of course, our emergency travel coverage, which is very much enjoyed by most of our members, is available with the ARTARx plan as well. And that travel plan is exactly the same travel plan we offer under our other plans as well. So that's it for the ARTARx pharmacy and benefit plan presentations. If you do have questions, please enter them in the Q&A box in Zoom, and we will stick around in order to answer any questions that arise. Thank you.